In this segment, we're going to be doing cervical soft tissue techniques, and our first technique will be a cervical traction. When doing soft tissue techniques, there is generally a rhythmic on and off type mechanism or a constant, just fairly deep, moderate to deep pressure with these techniques. The first one we're going to show you, as I said, is cervical traction. Patients with paravertebral muscle tension, trapezius muscle tension, levator scapular muscle hypertonicity, etc., all seem to do well with this technique. This technique, even though it's a soft tissue technique, is also used for cervical degenerative disc disease and cervical arthritis to help separate the intervertebral disc areas, as well as opening up the intervertebral foramina. So the first way we're going to show you is placing a hand and contouring it under the base of the skull, and then taking the other hand, using the hypothenar eminence of the hand just under the chin, lifting the head slightly into a minimal flexion, and with the arms relatively extended, just lean back and stretch the neck. In doing this technique, patients that have acute cervical strain, etc., usually don't like it. So it's usually something in a more chronic situation or chronic degenerative disc situation, fibrotic changes in the tissue, etc. And you can see I'm just slowly putting pressure on and then slowly taking the pressure off. As you do this, try to determine the nature of the patient's tissue texture consistency, how when you put the pressure on, are they guarding? Does it feel like it's causing them any pain? And you can do this in such a way where I can now just hold constant pressure on her neck for 10, 15, 20 seconds and then let it go. Or I can just put a rhythmic on and off every few seconds. I can put pressure on where it's very minimal, with a little more pressure, with a little more pressure, with a little more pressure, and get up to a fairly strong pressure, hold it, and then release it very slowly, and just titrate the pressure slowly, slowly off. Now, as you can see, with the hand on the jaw, if we're compressing the patient's teeth together, and they have a temporomandibular joint problem, where the jaw articulates here with the temporal bone, we can vary it by putting our hand over the top of the head on the forehead and just compress down just a little bit to help our bottom hand not slip off, and then just lean back using the bottom hand traction. So if you have a patient with temporomandibular joint problems or teeth problems and gum problems that don't like that pressure through the jaw and the teeth, you can do it this way. When you do it this way, make sure that you get high enough up that you're not right over the eyebrows. Otherwise, you're going to be pulling the patient's eyebrows up and opening their eyes, and they don't like that. It's a very uncomfortable situation. So this is cervical traction with a variation for temporomandibular joint problems.